a more distant Thanksgiving, but I hope people can really celebrate and feel the love for each other. I believe that is entirely possible while still keeping everybody safe and hewing to our public health guidelines. That is necessary right now, and smart and wise and consistent with loving each other, because we are in the midst of a raging pandemic that I have to report has been most impressive in how fast this is moving. Right now, this activity is so high. Our statewide rate of COVID-19 transmission is 300 people per 100,000. We've had more than 6,000 cases that have been reported just in the last 3 days. And as the accompanying graph would indicate, we have almost a vertical curve on how fast this pandemic is moving upwards. It is really quite stunning and certainly alarming to all of us who understand what the future could hold if we do not act aggressively against this pandemic. Unfortunately, as a result of that, of course, hospitalizations are also near an all-time high. Nearly all counties have high and rapidly increasing rates of disease and therefore hospitalizations. As the chart indicates, our hospitalizations are essentially in the same area as they were in March, when we had to proclaim our first stay home order, and we all know how difficult those days were. Well, our hospitalizations are back either to or exceeding those levels right now, and unfortunately we've already had several hospitals indicate that they're starting to plan to curtail elective surgery and other less emergent problems as a result of the crowding we're experiencing in our hospitals. This is why we have deliberately established targeted restrictions aimed at slowing the spread of the pandemic, and we are hopeful that they will work. We are hopeful that they will start to slow down this pandemic growth. When those measures are combined with Washingtonians' smart actions to follow science and protect ourselves and our loved ones, and that is going on across the state of Washington, and for that we're very appreciative. We're not the only ones who have demonstrated a belief that Washington is an exceptional state, and the most recent evidence of that was an article today in the New York Times. The New York Times did a survey of Americans all across the country to determine which state had the most people, the highest percentage of people, who were acting safely to keep their Thanksgiving celebrations within their households. And they compared all the states. And they concluded that Washington State, on that scale, as to what state has the most residents per capita that are acting safely this year around Thanksgiving, the #1 state is the state of Washington. And we have led this country in so many different ways. This is just another way we are leading the country, and it's something we ought to be proud of. Because when Washingtonians have celebrations just with their immediate household this year, they're saving lives, and we've done this throughout this pandemic. That is why there are probably 45, 42 other states that are in worse shape than we are today, because we have acted to follow the science, and we have acted out of our sense of love and compassion. And we've done it yet again, confirmed by this data from the New York Times. So we're doing the right thing in so many different places, and we know if we keep doing this, we're going to knock this pandemic down. Now, one of the reasons we've been successful, I think, is that we have been sharing scientific data so that people can make decisions. And we'll continue to do that in a variety of ways. Our most recent, we're trying to provide people information in every form. The most recent is on a television commercial. I just want to show it to you. It started running, I believe, yesterday. If we can just play that.
COVID-19 can find you here. When you're just trying to celebrate, it can find you here. When you're with your closest friends, or even here, when you're spending time with family. Wear a mask Stay 6 feet apart. Don't host gatherings, even in your own home. Protect the people you love.
The point of this commercial is to share information we've learned, which is that we've been quite successful, we think, in bringing safer environments into the workplace, into our common areas by wearing masks and socially distancing. But what we found is that these social gatherings, football game parties, Thanksgiving dinners, these social settings are now something that are very dangerous, as dining in restaurants. So we wanted to share that information. There will be a commercial starting in the Spanish language as well, because we know folks who speak Spanish are, unfortunately, have been disproportionately affected by this pandemic, and we want to reach them. It is very clear that our small individual actions will tell the tale. There will be no single decision that will beat this pandemic. It will be the combination of 7 million decisions that can beat this dreadful disease. We have, of course, the medical professionals, the people in the front line, and we've got two folks on the front line that I'd asked to share some comments about what they have experienced and observed. Dr. Nathan Schlicker is president of the Washington State Medical Association, and Betsy Scott, a nurse and vice president of SEIU 1199 Northwest. They're just two of the voices who have seen the damage wrought by this, and I wanted to ask them to share their observations at the moment. Dr. Schlicker.
Thank you, Governor. I really appreciate the opportunity to be here with you to share this important message. While I serve as the president of the Washington State Medical Association, I'm also an ER doctor on the front lines, working to care for our friends and neighbors and our family throughout this pandemic. And I have to say, I appreciate so much your message of stay home, stay safe, and stay away from gatherings. I know that it's tough, but a test today, even if you go out and get swabbed, doesn't mean you're safe tomorrow or Thursday when we gather. And it's not just your small bubble, it's every piece that your bubble touches. And that's how the disease gets through all those little cracks in our safety net. And as you touched on, our hospitals are at record capacity. My health system is now above where it was in April, and many others are facing that tight crunch as well. We've seen it with surgeries getting canceled. And more importantly, even where we have the beds, we still need people working in them. Our staff is getting sick. We live among each of you, and so we struggle with having people to care as well as a place to care for them. And when we're talking about limiting surgeries, it's not like we're talking about minor things. We're talking about real diseases. I took care of a man last month who didn't get his defibrillator because it was pushed back because of the COVID outbreak and not having space to care for him. And he had his heart attack and his arrhythmia and didn't survive. I've got colleagues that are in their 30s that have chronic heart failure now from battling this disease and have sacrificed being out there. So when we talk about this, it's personal. It's not just personal because it's our family, it's because it's our colleagues, it's our nurses, our physicians, our janitors, our secretaries, our everybody that we see suffering with this disease. And taking it seriously like we do helmets and seatbelts is so critically important, because if we're going to respect the sacrifice that so many Americans and so many Washingtonians are making in this battle by being apart, by caring for each other, by keeping our distance, then we need to do what we can in our daily lives. And that means wearing a mask and not getting overly excited that just because the vaccine is on the horizon, it doesn't mean that we can ignore all of the public health measures today. Because we don't want to see you in the ER. We want to see you healthy and at home with your family. Maybe not in person this year, but definitely they're in person next year. And we share your frustration. We're all tired of it. I'm tired of the, fatigue of wearing a mask 8 hours a day or more in the ER, of, the bruises and rashes and, all that comes with that, all the struggles that we have. But we can't give up just because we're tired. We have to dive in and we have to do the hard work, because it's heartbreaking to watch people die from this disease or preventable. It's heartbreaking to watch people not get the care that they need. because we don't have space to do anything other than COVID. And it's harmful when we see that people are denying that this is a real disease. This isn't a hoax. This isn't something that's no big deal, because it's not just the 1 or 2% that die from this disease. It's the 10% that have lifetime implications. And all those, like a young man that couldn't get his defibrillator, that don't get the care they need. So this Thanksgiving, I know it's tough, but from the medical community, please stay home, stay safe, and stay virtually together, but let's not gather in person and increase the challenges we've already got. Stay safe, Washington.
Thank you, Doctor. And what I really appreciate about your message is that we all have a stake in this. It has been such a misimpression that it's just people of age who have a stake in this. It's everybody, even if they're never going to get COVID, like you said. I'm sorry to hear about, a friend who was unable to get the defibrillator. COVID, he didn't get COVID, but COVID might have been responsible for his loss because he was unable to get treatment. And that's a situation that affects all of us, regardless of what age we have. So I really appreciate your comments. We now have Betsy Scott. Betsy, looking forward to your comments.
Thank you, Governor Inslee. Thank you for inviting me. I appreciate this opportunity to talk today. I'm a nurse and I'm on my hospital's COVID task force committee. Our committee has been meeting at least twice a month since Washington's outbreak in the beginning of the year to deal with all things COVID, from shortage of masks and other PPEs to quarantine pay and staffing issues. I don't work on a COVID unit, but I've had to face down the fear of being exposed without proper PPE protection and have almost daily conversations with coworkers who go to work every day fearful that this is the day they will get sick and take COVID home to their families. Recently, my daughter and son-in-law both got sick with COVID, and the realization that either one of them may have needed to go to the ER to receive care terrified me. And although they both became very sick, neither one had to access emergency care. Thank goodness, because I know what that experience might have looked like. For those patients that do have to go to the ER, there is overcrowding and long waits, with patients being cared for on gurneys in the hallways as they wait for a bed to open up in a hospital with too few staff. I imagine my 31-year-old daughter all by herself waiting to be admitted, for families not allowed to accompany patients into the hospital at this time. She is febrile, she has body pain, she's got a horrible sore throat, a cough, she's short of breath, and she's scared, and she's by herself. Finally, she's transferred to the floor that is short-staffed and where call lights take too long to be answered. 3 nurses called in sick, 2 with possible COVID, so they will be out for 14 days, and there's no one to cover them despite multiple emails and phone calls to all the staff to come in on a day off to help out. The nursing assistant assigned to care for her has 4 other patients, 2 of whom need one-on-one help to eat. So my daughter seldom sees her. Does my daughter call me as she continues to get more short of breath, more scared? Could I sit at home when she calls me crying to tell me that she's being transferred to the ICU, that she's scared, that, again, she's all alone? Could I bear it when the nurses call me to tell me that my daughter's oxygen levels are dropping? There's a terrible shortage of nurses in this country. ICU nurses, because of the difficulty of the job, are amongst the shortest. We as a state are now competing with every other state for the ICU nurses out there as this pandemic fills our hospitals across the country. Our ICU currently does not have enough nurses. When my daughter, in my nightmare, gets to the ICU, the nurses haven't had breaks. They've been picking up shifts every week, working double shifts, working with a few traveler nurses who are getting paid premium hourly wages to come help us out. And they have nurses from other units who have had some training to assist the ICU nurses in the complex technical care required of ICU staff. They've been at it for 9 months. The nurses and staff are tired. They don't always see faces anymore. I hope they see my daughter's face. This was my nightmare when my adult children got sick a couple of weeks ago. Fortunately, they didn't need hospital care, but my daughter and her husband took over a month to recover and to return to work. This scenario is a living nightmare for thousands of other families and patients every day. They are living this today in Seattle, Spokane, Boise, Missoula, and elsewhere across the country. Please wear masks, everyone. Socially distance. Stay home for Thanksgiving. Allow our nurses in our hospitals, allow us to take care of those of us who need the care, and don't overwhelm us with more patients in the hospital. Thank you so much.
Thank you, Betsy. We appreciate that heartfelt description that so many families are facing right now. And I just want to thank you and your colleagues. Doctor, thank you, your colleagues. You've been called heroes, and it's an accurate description. You've been at this for so long. And I'll just tell you the way I look at this. If we ask you to go in there every single day for months and expose yourself to COVID, frankly, the least we could do is maybe defer a dinner for a while. And I hope that the more of us who do, the more of your members are going to be able to go home safely to their families. So thank you for your efforts. I want to share some good news that help is on the way. We had a good call with the federal government's vaccine team with governors from across the country yesterday. And there is a lot of good news in this regard. Vaccines are going to be ready to go. We think there could possibly be first administrations in mid-December, perhaps later December if things slip a bit. And active plans are now in place for the distribution of that. So we know that the help is going to be here in a relatively short period of time. Now that is not going to be available to the majority of Washingtonians for some time after that. It will be into the next year. But it is not 10 or 20 years away. We have demonstrated our ability to do well relative to other states. And if we continue to demonstrate that commitment, we're going to be in much better shape when the vaccine is generally available next year. And it will be available to those in the highest priority areas in December. So there really is good news available to us to get to that goal line if we just stick together in the next few weeks. And those next few weeks, in fact, will be critical. I'd like to close my comments by congratulating President-elect Joe Biden, and I like saying President-elect Joe Biden, in making the appointment of Special Presidential Envoy for Climate, former Secretary of State John Kerry. I think this is a tremendous thing for the country in a number of aspects. One is the obvious international credibility and talents of John Kerry, who's been working on this subject for decades, who has been instrumental in some of the international work together that has happened already. But the best thing is by putting a person of this level of commitment and credibility in this internationally important post, it demonstrates that America is back. And when America's back, we've got a much better chance to beat climate change. And this also demonstrates President-elect Joe Biden's firm, unalloyed commitment to fighting climate change, to make this appointment. So I could be not more delighted in this, and I think it bodes very well for what this administration will be able to accomplish. With that, I will be happy to yield for questions. Kathy Lofi is also with us if there are questions, or Dr. and Betsy will also take questions. Fire away.
Governor, I know you said we could see a vaccine by mid or late December, but the governors of Ohio and Tennessee said today that they're expecting their first batches by December 14th or 15th. So is there just not yet a firm date for us? And do we know how many doses we'll get in that first batch?
There is a firm date, but I didn't use it because sometimes slip a few days. But those are the dates that all the governors have been advised. And so things are very much apace. Now, we will also have, as you know, a state review to assure the credibility of the report. But everything looks like it has been done according to the highest standards to date by the evaluation. I see no reason that we should not have credibility for these vaccines. I am very, very pleased by something, and that is that the medical part of our federal government has remained intact with its integrity of the scientific process. Now, I know that was threatened by some of the things the former president did, but they were resistant and unyielding, and they have run, to all my knowledge, a very, very scientifically credible evaluation process. So we see no reason why this can't move forward very, very rapidly. My latest briefing on this, on our vaccine distribution system, at the moment looks like we will have the capability to do what is need to be done. This includes refrigeration capacity, as you know, and a data tracking system, and those things are in deployment. So we are very happy about this. Now, I want to reiterate this. This is not going to be generally available in mid-December. It will be first available to medical professionals that have to do the high-risk procedures. It will be available to folks that have, serious morbidities that put them at higher risk. And we will work our way through it so that everyone can get access to the vaccine. But I see this as very, very good news.
Yeah, I just wanted to see if you had a ballpark number on the number of doses that we'll get. And then also following up on the concern expressed about some hospitals being at capacity, what is the plan if we do run out of hospital beds for those patients? Would we ask for field hospitals back as New York City has done?
Well, we will go through a series of decisions. The first thing would happen would be to add bed capacity in the existing hospitals, and that can be done relatively easily by just adding beds. But the challenge is to have the nurses and respiratory therapists and the physicians and the ICU experts to staff them, and we will do everything humanly possible to bring in additional staff, both by those who may have been recently retired or others potentially from the military. The military is now offering nurses to North Dakota because North Dakota has, like 10 times as many infections as we do. Unfortunately, North Dakota did not make the decisions to close some of their businesses and mask up that we did, and as a result, their hospitals are overwhelmed right now. So we would then, the next tranche would be to look at additional facilities like pop-up hospitals as we built originally in March or April in Seattle. But the long pole in the tent, actually, this is much more the personnel than the physical assets. We have adequate ventilator capacity now, so ventilators should not be in shortage. Even if we do have a surge, that's good news. But we need nurses and physicians to staff that ventilator. It's very, very intense care, as you can imagine, and that's where the real challenge is. As far as the numbers, we do have a number. I just don't have it off the top of my head, so I'll have to share it with you, Rachel, and everybody on this call, of what should be available in December. And I'm just... Kathy, I don't know if you had the numbers from that briefing yesterday. I have it in my notes back in my office, but do you know the exact number?
I do not know the number that you were told yesterday. We have been given different numbers, so we're still trying to nail down exactly how much will be coming in our first shipment.
So we'll try to get you that number later in the afternoon. We'll share it with everybody on the call.
Next question comes from Joe with the Seattle Times.
Yeah, question for Dr. Schlicker and Dr. Lofi. If you see cases continuing where they are for another 2 weeks, 3 weeks, what will be the situation with hospital staff across the state in terms of having enough people?
Dr. Lofi, why don't you take that first?
Sure. So I'm very concerned about the trajectory of our current outbreak. The governor didn't show you the graph that we have today of the number of confirmed and suspected patients in our hospitals. And that graph is increasing very steeply. And I'll show you that tomorrow during our press briefing. And we're very concerned about what this is going to mean for our hospitals. As you know, our hospitals have just started to, delay some non-urgent procedures. If this trajectory continues, they are going to need to probably delay most of their surgeries and really only do sort of those most critical surgeries, that need to be done right away. So I'm very concerned about that because, as Dr. Schlicker said, that means people are not getting care that they need. So that is what is going to happen probably next over the next couple weeks. And then, the other thing that hospitals are able to do is that they all have surge plans in place, and that those are plans to care for more patients than they normally do. They would initially start cutting back on almost all, procedures that can wait, and then implementing those surge plans to see more patients than they usually do.
Dr. Schlicker?
Yes, thanks. Dr. Lofi laid it out quite well. What today we can hold off on that are non-emergent cases, that definition and that delay becomes so much more. And non-urgent doesn't mean not important. I can't stress that enough. Whether it's a defibrillator that we think today we can put off, eventually that's necessary. It's needed care. If it's a hip replacement or a knee surgery, those kind of surgeries are important to the people that are living with that chronic pain. And I know, Governor, you've spoken about it in the past. We know that in this pandemic, people are suffering, with chronic pain, that addiction is going up, and there are a lot of other downstream consequences. So I think it's really important that while we talk about, yes, we can buy some space by limiting surgeries, we're buying space and we're buying time for us to rally as Washingtonians to do the right thing. If we don't do that, IMHE and others predict our peak isn't until February, and eating up far more than the available space in our hospitals. So I would say that all the things we're doing now are to buy time for all of us to rally together, not to ignore the problem that's before us. So again, mask up, stay distant, have a lovely Zoom Thanksgiving, and gather next year.
Yeah, if I can add to this, the weight that is on our shoulders right now is the knowledge that unless something changes in the course of this pandemic, we will reach a situation where hospitals not only have to deny people care for a whole multiple of things, cancer treatment, defibrillators, hips, knees, you name it, but they will also have to move into a critical care situation where they simply cannot provide care for critically ill people whose life is threatened. And we'll have to move to some degree into a triage situation to see who can get that adequate care. And that will happen unless this trajectory of this disease is changed in some fashion. We cannot allow that to happen in our state. I do believe that, and we're asking the Institute of Disease Modeling to give us more projections on this, but from my observations, in December some point, unless something changes, we very well could be in a situation that with catastrophic loss of medical care in the state of Washington. Dr. Schlicker, do you want to talk about the critical care decision-making situation where you move into?
Yeah, the triage and crisis standards of care is something that we have thankfully been able to avoid to date. And we've talked about it often when it comes to equipment, who gets the last ventilator, who gets the last ICU bed. But I think what Dr. Lofi and all the disease modeling have talked about is that it's not just equipment, it's space and it's people. Surge plans, Ms. Scott described it so well. The overworked, overstretched nurses can only answer the call light so fast. We can't multiply and divide nurses. We can't simply toss another body into the problem. We have to recognize that at some point, if we don't change the trajectory of this disease, we're going to be making choices that people are going to be uncomfortable with, that will leave a permanent scar on those that have to make those hard decisions. I think all of us felt that grave concern in April when we hit our first spike, and we're grateful that we came down. But this peak is not demonstrating that it is going to relent in any way. it continues to climb and grow, and our people are just under such strain. And that triage mentality and that crisis standards of care will be something that will be hard for the people making those decisions, and will be hard on the families who hear that their loved one doesn't get something that they feel is needed. And you know, we know that's limited resources. You can take anything. ECMO, there's very few beds for ECMO in this state. Extracorporeal membrane oxygenation. You know, there's going to be tough choices to be made there. There's going to be tough choices about who gets an ICU bed. There's nothing more to say than we got to change it, or no one's going to like the decisions made.
By the way, if I may, you know, these are not easy things to talk about before we head to the joy of Thanksgiving. And there is a reason to have joy with our loved ones, even virtually. But it is necessary, and if we do look ahead, which we do so well in the state of Washington, we always look ahead. If we look ahead, we got a really good shot of avoiding those consequences. And that's why we're sharing this information with citizens today.
Joe, would you like to ask a follow-up?
Yeah, Governor, if what you described is accurate and the state faces a critical medical care shortage in December, we're talking just a matter of weeks. So what sort of plans or steps are you thinking in terms of calling in federal resources like the military to help staff medical units?
Well, all I can say at the moment is it is a potential option for us. We don't have current plans to ask for a specific number of nurses. At the moment, that is not necessary, because what hospitals are doing is starting to defer and delay the other surgery that is not as life critical. So they're dealing with this problem by denying people health care that they otherwise would have available. That's very painful to these patients right now. But they're sort of creating capacity by stopping, at least delaying some of these processes. So, you know, that can buy us some period of time, a couple of weeks maybe 3 weeks, but at some point you have to get additional personnel into the system. So I can't tell you when or how, but it is in the future if something doesn't change.
Next question comes from Keith with Como.
Yeah, Governor, given the dire situation, is there any consideration that your 4-week period is not going to be met, that you're going to have to extend the restrictions on restaurants and the bowling alleys and gyms? Or is there a possibility that you could open up some of the gyms and some of the bowling alleys, since they don't gather, like you said last week, they don't get together in close proximity?
So in answering that question, I want to refer to the data. Can we put up the graph showing the infection rate? So this is a graph showing the infection rate on a sort of a per capita basis in the state of Washington. And you see that it's almost heading straight up right now. What I can tell you is that we cannot tolerate the continuation of that straight up curve for very much longer. And what we have done is we have had targeted reductions of social interactions in the hope that we can change the slope of that curve. It is not what we proposed in March. In March, we essentially had to shutter vast swaths of our economy and ask people essentially to stay home unless they were involved in some essential activity. It worked. We actually have not done that to that extent this year or this month. We have instead had a more limited and more targeted approach to try to reduce those interactions in restaurants and gyms and bowling alleys and social settings and households, if people follow our advice and the rule right now. We've had a much more targeted approach. We are hopeful that that more targeted approach can bend that curve down. But if it does not, we will have no other option but to extend those restrictions to other parts of our economy. There will be no other option available to us. We've already adopted successfully this masking campaign. It's been very successful. It's kind of a bullet we've already fired. We've got vast swaths of people wearing masks, and we think that has helped. It's one of the reasons we're in the top 5 or top 10 states in the country to keep this pandemic at relatively low numbers. But in answer to your question, I cannot predict the future. It is possible that these could be reduced in restrictions. It is also very possible that they will be increased in the event we cannot bend that curve down, because we will not have any other option available to us. We cannot have people dying in the parking lots of our hospitals in the state of Washington. That will not be acceptable to us.
Keith, would you like to ask a follow-up?
Given the dire situation for the restaurants, is there any consideration of bringing the legislature back in for a special session to extend the amount of money that would be going to them? Oregon, Colorado, several other states are already back in special session.
I think I heard your question. As you know, we have already taken action. I already made a decision after talking to legislators to extend $135 million of benefits to some of these affected business folks. And we will also have, and this is forgotten, it's not just the business owners that are affected by these restrictions, it's the employees. For every business owner that's having difficulty, there's, 10, 20, 100 employees that need assistance. And we need to make sure those folks are cared for. And we need to look at ways to make sure that the unemployment compensation is extended and the PUA federal benefits are extended as well. And so we are talking to legislators to see what ideas they have to accomplish those ends. But we'd obviously need to have an answer to that before we call it a session. And we are also continuing to push the federal government to act, to extend these benefits, including help for businesses. So work is underway. There are conversations every day with legislators. I talk to them every day. And those options are still being considered.
Next question comes from Laurel with the Spokesman Review.
Yes, this question is for Dr. Lofi. Do you know the percentage of COVID cases that do require hospitalization at this point? And at what point will we start to see changes maybe in that data based on the restrictions from last week?
I don't know offhand the proportion of our cases that are requiring hospitalization. We'll have to get back to you over that with that information. But in terms of the time frame for seeing effects in our data after measures are put in place, I mean, it's typically at a minimum about 3 weeks. Because when you think about it, the person who gets infected today, it will take another 5 days for them to develop symptoms, and then it'll take several more days for them to get tested, get a test result, and have that result come to us. And then, as you know, as we looked in our data, we don't get all the data in, the data from the last, several days is often not complete. So generally, we need about a 3-week time frame. But sometimes we need even longer than that to really be sure of a new trend. Because if things do start to level off or things do start to go down, we like to see that for probably 2 weeks to be confident that that is the new trend.
Yes, Governor, you mentioned last week the importance of not getting a test just to go to Thanksgiving. Do you know, has there been any limits on testing capacity? Are there any strains there? And have there been some of these long lines that we're seeing across the country now that we're 2 days away from Thanksgiving?
I believe there have been some longer lines at various facilities, but we are doing sometimes 30,000 tests a day, so those tests are getting done. And yes, I do think it's helpful if people don't get a test just to go to Thanksgiving dinner. It's better to have Thanksgiving dinner and communicate virtually. That is a better position. So we're asking people, if the only reason you're getting a test is to go to Thanksgiving, please do not do that. Please figure out a different way to enjoy Thanksgiving and let that limited testing capacity used by people who might have symptoms, might have the disease. we are asking people to do that, and I hope they'll listen to us. Kathy, do you have anything to add to that?
Nope, I agree. Best thing to do on Thanksgiving is to stay home and celebrate with your immediate family.
Next question comes from Simone with Q13.
Hi, Governor, and everyone. Thanks for the time. Regarding the field hospitals, Governor, as we look to see our hospitals start to reach these surge plans and reach their capacity, we're in a much different position than we were back in March when field hospitals were first brought to our state, when we were the epicenter of the outbreak in the beginning. Is there concern that we're not going to be able to get the federal help that we may need if this trend continues, considering there's so many states in more dire situations than ours?
Yes, that is a very legitimate concern, because individual states could look to other states for help or the federal government early in the pandemic. But now that this is swept across the whole country, that reserve capacity no longer exists. So that very much is on our minds, and that's why we hope people don't have Thanksgiving dinner with folks outside your household. And that's the best thing we can do right now to prevent that emergency from occurring in our state. And by the way, I want to reiterate, this is not just a prospective issue. This is happening today. There are hospitals planning to reduce normal medical procedures for us today. And if you look at these curves, we just don't have any more time to act. And by the way, if I can, just share a little bit of frustration here. I heard a woman screaming out in the street the other day in a megaphone saying that COVID is the biggest scam in American history. It's very difficult for me to understand that, given what you see in our hospitals today in the state of Washington, and look into the faces of the people who have lost their family members. I heard a nurse the other day just breaking down in tears because she'd been dealing with this pain for 8 or 9 months now. It's very difficult for me to understand people who just blow this off. I can't understand that. And I just hope that people care enough about their loved ones that they will want to have the biggest Thanksgiving celebration in human history next Thanksgiving, which you can't do if your relatives aren't alive. And I just am asking for people to think seriously about that in the next 48 hours.
Simone, would you like to ask a follow-up?
Yes, Governor, I'd like to follow up a little bit on what you're talking about, because while it may be baffling to you, there are a lot of people out there that are not taking this seriously and are not taking your restrictions seriously. Back when you first implemented stay-home orders, the biggest success of the state in being able to turn the curve in a different direction was people following those restrictions. We haven't seen that kind of response happening this time around, even though you've already implemented many of those same restrictions. What's left in your tool belt to handle this if people continue not to listen and we see really dire situations in our medical field?
Well, all is not lost. Let us remember that we have had relative success. As I indicated, the New York Times did a survey of something like 200,000 Americans and concluded that Washingtonians are the smartest, because we are going to have the fewest people who are not complying with our household gathering limits. We have the most people who are showing that they love their family members by not having big Thanksgiving dinners. So we have had actually the most compliance of any state in the United States. We ought to celebrate that. And we ought to just use that to try to talk to the other folks that, aren't quite there yet. This is new to us. It's not surprising that people find some of this work difficult. First off, it's been a long time. It is something we've never had to do before. I'm 69. I've never had to think about not having Thanksgiving dinner. That's a new experience. So it's not surprising, and we just have to keep talking to people, sharing information, and hope that the sense of love for their loved ones kick in here.
Next question comes from Austin with Northwest News Network.
Hi, Governor. Along those lines, this is really a question about who the messengers are. You've had today a doctor and a nurse. Previously, you had Mayor Durkin and King County Executive Constantine. But where are the Republicans? Where are the Eastern Washington Republican voices, perhaps, that might be more compelling to those who are not compelled by what you're having to say, and perhaps not compelled by what the mayor or the King County Executive have to say?
Well, I would love to have more Republican voices helping in this, as you know. There's been a couple. County Executive Dan Meyer had some relatively gracious things to say about our last decisions. So, you know, there's been a few Republican voices that help us. What happened early in this pandemic, we were having a lot more Republican help in this regard. Which was really gratifying. But I'll tell you what happened in this, which is very disappointing to me. The day that Donald Trump tweeted, "Liberate Michigan," when Gretchen Whitmer put some restrictions on to save people's lives in Michigan, that was then followed by allegations of people who wanted to threaten her life. The day that that happened, the Republican support across the nation evaporated to help us, and it's been very disappointing. We would love to have Republican folks speak more broadly in this and offer their ideas about how we reduce this pandemic. And it has just been crickets from them, and I'm disappointed by that. I heard the Senate leader the other day say something to the effect that, you know, this is not an emergency. I have a hard time understanding that given the nature of our losses. I talked to J.T. Wilcox. I appreciated every conversation I have with him. He said that he does look for ways to share information with people that this is a serious issue. I appreciate his comments to the extent that he has said them. But we could use a lot more Republican help to stand up and frankly support some of these tough decisions. These decisions are not easy. And it would be most gracious of them to support issues that are going to save people's lives. So I welcome it to the extent it has happened. As I mentioned, Representative Wilcox, I thank them for it. But it's not for a lack of trying. We try as well as we can to get every voice we can. Now, I'm hoping that when Donald Trump leaves the White House, as he will, that Republicans will feel more free to express what might be their personal views, that we do have to be responsible against this virus. So I'm hopeful that that will allow Republicans to step up to the plate more.
Austin, would you like to ask a follow-up?
I would, and this is kind of a related question, and it just has to do, I know you've been asked a lot about why not a special session, why haven't you called a special session? My derivative of that question is it's a balancing act question. Why, I know you need to navigate an emergency, and part of why you have executive authority and emergency authority to do that is to, when there's an emergency, not have to go through the legislative process. But it's been 269 days since you first declared a COVID emergency. That's about 3/4 of a calendar year. And you know how strongly worded our Constitution is about the consent of the governed and that all power is inherent in the people. So how do you balance that from where you sit in terms of incorporating the will of the people and their representatives in the legislature with also the need to act in an emergency fashion?
Well, listen, I will be happy to call a special session when two conditions exist. Number one, it's necessary. And number two, we can have a belief that it will be productive. And when those conditions exist, I'm happy to call a special session. To date, it has not been necessary because we have been able to act with considerable success. Now, you've heard me say this before, but I'm going to say it because I think it's important. We are in the top 5 states in the United States in beating this pandemic, top 5. And the reason for that is that we, as a state, have made decisions to fight this pandemic rather than give it up. And, frankly, one of the parties wanted to give up. We're not going to give up against this pandemic. No, sir, we're not going to do that. So we are committed to fighting this pandemic. And so far we have been markedly successful relative to other states with the decisions. And we were able to do that. It did not necessitate legislative action. Secondly, you have to have a plan to make a session successful. And we have been able to date, there hasn't been a need that a legislative session could fulfill. And that may change. So because we had some restrictions, we know we want to help businesses and employees. And I was able, without the necessity of a special session, to bring to bear $135 million. Other governors have not been able to do that. They had to call a special session to do that. I was able to do that under the current situation. Now, going forward, we have some challenges that will need legislative action. We will need action to, in my book, help employees that have been unemployed as a result of these most recent restrictions. And there might be about 200,000 of them. And they will be losing unemployment compensation at the end of the year. And gig workers under the PUA federal plan will also lapse at the end of this year. We will need, I believe, and we're checking on this, but it is likely that we will need a legislative session to solve that problem. Now, that's not a sure thing because we are now examining some pockets of resources that might allow us to help these folks even without a specific legislative action. So it may be necessary, but at the moment there isn't a plan to do that the legislature is capable of passing that is necessary that I couldn't do myself through these actions. So those are the reasons. I will also note that to some degree, had we called a special session earlier in the year, through no fault of their own, we would have made some bad decisions because frankly, we would have made decisions. Folks wanted to cut social services to needy families, many of whom are hungry right now, in the middle of a pandemic. And it turned out we didn't need to do that because we've got better economic conditions. We've got some, we've had probably $2 billion of new projected revenue since that time. And so decisions would have been made on false assumptions economically. So the decision not to do it earlier, I think, has been vindicated largely by results. But I want to reiterate, I talk to legislators virtually every day, and if they are proposing things that can pass the legislature in a timely fashion that we can't solve otherwise, we'll continue to think about that. And that includes help for the business community as well, because we know the business community has had real significant losses as a result of this pandemic.
Next question comes from Carolyn with the South Seattle Emerald.
Hi, yes, Governor. I wanted to ask, it's obviously very difficult to enforce masking and non-gathering rules amongst individuals, but are there any plans to increase the labor and industries investigative and pursue more active enforcement rather than reactive enforcement to ensure that businesses are following masking and distancing rules?
We actually had a meeting with our 4 agencies this morning on this subject, and we have new ways to bring more efficiencies to the enforcement process. And I think you will see shortened periods of time that now are still consistent with the law. If there are businesses that are unable or unwilling to comply, there will be enforcement. It probably will be more rapid as a result of bringing some efficiencies to the enforcement action, because we really, the vast majority of businesses are complying with these rules, and it's not fair to them to have other businesses ignore the law. So you will see increasing enforcement of these actions, of these requirements.
Carolyn, would you like to ask a follow-up?
Yes, this one is for Dr. Schlicker. I was wondering, you referenced painful choices that hospitals will have to make if things don't change. What are those painful choices? Are you kind of talking about things like we saw in Europe where healthcare workers had to make some really difficult choices and not provide appropriate care or enough care for older folks?
I think that's what we've all feared since the beginning of this pandemic, and great work was done under the leadership of the Northwest Health Response Network and others to establish what's called the crisis standards of care, which says when resources, whether that be machines, people, space, or others, become limited, how do we decide who gets what care? And those are the tough choices. It's not just older folks, it can be those that may have the least likelihood of survival. And that becomes a very complex question about how do you decide if you've only got one ventilator left, one ICU bed left, one dose of a medication left, who gets it? Because I don't think any of us want to play God in this world and have to make that decision. And I'll tell you, as an ER doc, having done disasters in my career, you're always balancing the challenge of triage, of sometimes not being able to be in every room when you're the only doctor on, and the difficulty that is. But I've never had to proactively decide, no, you're not getting a ventilator. No, you're not getting this care because I only have one and I have two people to choose from. So it's a very different thing to go from a world where we're making hard choices, running as fast as we can because of limited resources and an unforeseeable disaster, and going into a world where we can see the disaster happening and having to make awful choices. So that's what we're talking about. We're talking about things that, will truly tear apart those that are going to be making those decisions.
Time for one last question. Final question comes from Jerry with the Everett Herald.
Governor, I wanted to ask about there's still some federal money under the CARES Act the state has to spend. I'm wondering, what are your plans for that money? How much of that might go into assisting with the contact tracing efforts, hiring of nurses, et cetera? How will you use the money?
We have not made final decisions about that. The Department of Health will have a briefing tomorrow about some of our contact tracing effort. I think you'll find that of interest. So we just have not made final decisions. I'm glad that we have held some money in reserve. Some folks wanted to spend all of that money months ago. We were criticized for not doing that, but I'm glad we held some in reserve now. I think David Schumacher's advice was really good to the state in that regard, so that we have some of this available for these needs now. So we'll make those decisions obviously in the next couple of weeks to make sure that that money is invested. It has to be spent out the door by the end of December, as you know. So we will make those decisions in the next several weeks. There's still, as you can imagine, all kinds of priorities for this, from assistance for hospitals to contact tracers to vaccination planning. There are many, many claims to help for businesses. We have been able to free $135 million for businesses, as you know. So stay tuned.
Jerry, would you like to ask a follow-up?
If I could, and related to the restrictions, I wonder if you could tell us what your conversations have been like with the tribes. We have areas like the Quilceda Shopping Center where the restaurants are still providing indoor dining, stores are, following their rules and not your restrictions. So what conversations have you had and what are you asking them to do?
Well, I have talked about the science to make sure that they're aware of the science that any indoor person-to-person unmasked contact for length of time is a transmission risk. And I've shared with them that that is a transmission risk of significant degree. And obviously we would hope that they would join us as much as possible. But as you know, that the tribes are not subject to my jurisdiction. No matter how many times you ask me this question, that can't change. So that's what we've talked about. No, just one comment. I was thinking of Austin's question about special session. I do want you to know that if this changes, look, neither the leadership of the Senate or the House have asked for a special session at this time. They haven't seen a reason for it or an ability to produce a product at the moment. So there is not a request by the legislature to have a session that would be productive. But if that changes, we will talk to you. And as I've indicated, we do have needs that have to be met and need to be met. And we are searching for ways to do that. And that work is ongoing literally on a daily or hourly basis. So don't think that this work is not going on. It's going on, and it will reach fruition. With that, happy Thanksgiving to everyone. Take care.